Take it away, Todd.
Okay, thank you very much. I appreciate it. And just before I start, can you hear my voice okay? Is it loud enough? Does it seem okay? Okay, very good. Again, I'm traveling, so I don't have my normal settings. So I just want to make sure that I'm coming across okay here. Well, welcome. I'm Todd Shermer. I'm COO of American Home Care Services. My partner John D'Angelo will also be on the phone here today as well, or on the video call. So I think we should start with probably, who are we? Our company was developed by people that were in the industry for many years. I hate to date it all the way back, but we can date this back for myself back to the early 90s is where I started on home health care, long-term care, Medicare supplements. And with back in those days, I will say it was hard. It was tough. You go in and you talk to someone, you thought that you had a sale, and you find out that the underwriting would shoot it down right away. So half of the commissions you already probably more than likely already had spent in your mind anyhow. The time that you find out a couple weeks later that the product itself was never going to be issued because the underwriting found something in the health area of that client that said decline. So what we did as a group of guys that worked in the insurance industry for a long time, we realized that there was a lot of problems in the industry, and some of those problems had to do with underwriting. The underwriter's job is basically to make sure that they don't get fired. And how do you not get fired? You don't let through a bunch of claims, and if you don't let through a bunch of claims, that means there's a lot of people getting turned down. So in the home healthcare industry, it started pretty much with a focus of nursing homes. And we quickly realized in the industry that not everybody wants to go into a nursing home. Yes, you pretty much get forced into it. And so you should have at least an insurance policy that would pay for that care at the time so you don't go broke. But what everybody really wanted to do is stay at their own home. They wanted to stay home with their loved ones that could come by, and they wanted to be able to have the freedom and the luxury of having what's familiar to them. And so the home healthcare industry was developed, and it began. And so it ran into the same problems. It started running into the same issues as nursing home plans did. So as old guys coming from the industry, we looked at that industry and said, what's wrong with it and what's right with it? What's right with it? Let's keep it. Let's not change that. Let's not alter what's good, but let's see if we can fix what's bad. And so we did. And so we came out and developed a product. And I shouldn't say we, because I actually didn't develop it. I helped later, but I was not the guy in the infancy of it. John and Mike were. And so what they did is they looked at it and said, okay, how do we add benefits without adding claims at the same time? And perhaps by sometimes being good is wonderful, but sometimes by being lucky, of course, and timing right is even better. And so realizing that a lot of the underwriters were really a little bit too stringent, we loosened up those purse strings a little bit. And so what the product was done is it was created for home health care services. And so American Home Care Service, our name, is a home health care service plan that will actually provide payment for your client in the need of that person having some type of a home health care need to keep them hopefully out of a nursing home. We don't want anybody going to a nursing home if they don't have to, because statistically, the end result, it's not good. So the way to heal up quicker and to have better health care is in the privacy of your own home. Some people can't afford that. So we designed a product that will pay for the care of the client, your client, when the time is necessary. But instead of being traditional insurance, we actually turned it into a membership, a service contract membership. And the reason we did that is because we could get away from some of the stringent type of underwriting guidelines that which were standard in the insurance industry. Well, by doing that, it allowed us to actually do things that you wish, as an insurance agent, you wish that, or a financial advisor, I should say as well, that you had in the past. Because if you're like me or John or anybody else out there that's been writing long-term care or any Medicare supplements or life insurance or anything, you don't get paid until it's through. In your mind, you might have been paid, but on your 1099, it doesn't show up until it goes through the underwriting process. So with that said, by having a membership, which we have, it is now approved in all 50 states, including Canada, by the way. Our company's been in business for 12 years. We have an A+ rating with Better Business Bureau, and we've never even had a complaint, which is pretty darn hard to get away with most of the time. So with that said, we developed this product for a few benefits that did not exist and still don't exist in home health care. One of them is age. So if you have ever had a person turn down because the cost, and I shouldn't say turn down, excuse me, they turned you down because the cost of the insurance was so expensive due to the fact that they were getting up there in age, that you'll lose your commission. Underwriting issues. When it comes to traditional underwriting issues, we took them out. So here's what the plan benefits will do for you. One, we don't have an age limit. You could be 100 years old and apply for this plan. You could be 105. We have several members that are over 100 years old. And the beautiful part about their age being up there, we don't rate them. So if they were 55 or 105, they pay the same exact amount. Our plans do not increase your premium as your age increases. And the reason being is it's a member plan. So if you're a member, you're a member, and it doesn't have anything to do with your age. It's a member plan. The next thing is mobility. This was a big one back when we used to have to write plans. They'd turn you down because the person had a cane. Well, that person has a cane doesn't really mean a whole lot. If they had a walker, that was a big one. You know, they'd always get turned down there. A wheelchair, don't apply because you can't even get it through. So these were issues. Our plan with the mobility is not a problem. I don't care. We don't care if they have a cane or a walker or a wheelchair. Fine, put them through. Also, folks in the past that had some type of cancer that they recovered, they had their surgery, everything looked good, they had a clean slate, that was still a problem. So with our plans, cancer recovery, you're recovered, great, apply, we're going to take you. Pre-existing conditions, we don't have riders. So if you had something in the past and you got past it, great. We're not gonna count it against the client because, or your client, I should say, because they had something happen in the past. So it's a pre-existing condition, no rider, we'll take it, no problem at all. Premiums, regardless of age or health. So if a person was to get sick and they put in a claim and then we paid the claim for a while and they healed up for whatever the condition and whatever the ailment might be, we will go ahead and continue that person down with that membership for year after year, and we don't increase their rate, and we don't actually put a rider on that either. Excuse me. Okay, and here's a really nice aspect of this. We have 2 questions on the application. 2. The question is, are you currently or have you been told that you need some type of home health care or a medical procedure? That's number 1 question. Number 2 is, are you currently have been told or diagnosed that you have a chronic illness such as dementia? Some type of dementia is gonna be the killer for us because we don't know what we're going to be getting into. We have two basic questions on the application. If they say no to those, you just did field underwriting. And here's the good news. If they say no to those, you're going to get paid. So you made a sale, you have a new client, they have a home health care plan. I'll share how you get paid and what the commissions are and all that in a moment. But the beautiful part about it is, as you're driving home at the end of the day, that application that you're going to hand in, you're going to get paid. You're not going to hope that you're going to get paid. You're going to get paid, and you're going to get paid on a weekly basis. So we issue everything on Fridays. If that application is in by Monday, you'll get paid that same Friday. If it gets put in from Tuesday to Thursday, you'll get paid the following Friday. It's that simple. We try to keep it as simple as possible. Now, the product itself is not difficult. It's quite simple. And so, to simplify things, again, we provide payment for individuals who become members. Those members are entitled to receive payment for their home health care in the event that an illness arises. We will pay up to a certain hourly amount. Our plans are all based upon hours. So let me show you what I'm talking about, and I'll bring it up if I can. I say that, and I was having a little technical issue right before we started, and I tried to get this one file over. It would not pull over. So what I will do here is see if I can share my website here with you. And the problem is with that is I can no longer manipulate my site. Okay, I'm going to try to do something differently.
All right.
Okay, great. Now, and I don't know what kind of view they have, the agents have right now. I don't know if they can see this on a full screen or not, but what it will do here in the left-hand corners will kind of give you an idea. I hate to have you do this because mine is microscopic. I mean, it is so small. Can you just read the first left-hand corner right there?
Absolutely. So we have a sample of the elite member plans. Custom plans are also available as well. So for 10,000 membership hours, which is equal to $250,000 of a self-pay value, that membership plan cost is $5,000.
Okay,
So that's
perfect.
the top
Okay,
one there.
perfect. So for the hours, again, let's go back to that. If someone selected 10,000 hours, which is, by the way, a lot of hours, and that's the top plan, the actual premium of that would actually be $5,000. Now, there's a significance to that. If you take the $5,000 into the 10,000 hours, that means we're only charging your client 50 cents an hour to cover their home health care costs. That's going to run us $25 to $35 to $50 an hour, depending on where they are in the United States. So when we pay a claim, I can assure you, we don't pay those home health care agencies 50 cents an hour. We pay them normal, but the premium is made so that the amount is only at 50 cents an hour for your client to actually be covered. So if you see on there as well, you'll see some other ones, and as a matter of fact, a very typical one, by the way, is 3,000 hours. So at 3,000 hours, your client would only pay $1,500. And again, how do you get to that number? Well, if it's 3,000 hours, cut it in half, because if you cut it in half, that means it's 50 cents for every dollar, or for every hour, excuse me. So if you had 3,000 hours, your premium is going to be half of that. It's going to be $1,500. If you had 5,000 hours, your premium is going to be half of that. $2,500. And so we kind of keep it as simple as we possibly can. So when you're in the field, you don't have to have a price sheet with you. What you just need to know is that if your client wants anywhere between 2,000 hours to 10,000 hours, their cost is going to be half of whatever their hours are. And we do monthly, quarterly, semi-annual, and annual. The advantage to do an annual, there's like three reasons to do an annual. One, you're going to get paid on the amount you collect. Two, the person is obviously not going to be canceling anytime during that year. And number three, and the most important, is they can have what is called a paid up plan. After a 10-year period of time, your client is going to have a plan that is paid in full, which does not exist in any other home health care or any type of nursing care policy in the United States without any type of a rider. There is no rider here. There is no additional cost. They, after a 10-year period of time, are paid up. Why would we do that? Well, one is because it allows them to have built up a little bit of credit. So let's just say it's year 2 or 3 or 4, and let's just say they picked a 5,000 hour plan and they've paid $2,500. Let's just say it's year 4. They've paid $2,500 4 times, and I'm going to round that up to $10,000. So at $10,000, if you will, they've been vested that money. So they only have 6 more years to go and they're paid up. If someone tries to come into the house or into the, or they come into someone else's office, then you have a very valid reason to say why they cannot and should not allow this person to replace this plan. This plan has built up credit in it, and so they're going to lose that $10,000 that they already have. Now, they're not going to get a check back for it, but they're building up a vesting schedule, if you will, to be where they're paid up in full in a 10-year period of time. So it does that because, one, we wanted to make sure that we get renewals. So we're helping you get paid on an annual basis. We're helping the company get paid on an annual basis. We're helping you books and keeping the company's business on the book. So it's a win-win for you. It's obviously for you and me, or me. I shouldn't say me, for the company. So it allows us to have something different, something unique, something someone can work towards, and have a reward at the end and be covered the entire time. Can we go down to the next page, please? Thank you. Okay. On the left-hand side of the brochure, and I really urge you very much so to actually read the brochure, because it was designed to help clearly understand what the benefit is of the company and what we actually do. And if you simply, I promise you, if you just simply read the brochure, you would know enough to go out and talk to your client. And it's that simple. And you should never overcomplicate this process, because it's really not complicated. It's a membership plan that pays for home health care when the care is needed, and it explains it right here into the brochure. And so we have the ability for you to be able to go on our website and download these brochures, and if print them out in color, please, because they're going to look terrible in black and white. But you'll have those available to you as well. And now, if you will, Catherine, if you can get back out of that just for a moment. Thank you. What's the next thing to the right?
So the next one to the right is the half-page ad proof V3.
Okay. Let's just go to that just for a moment.
For sure. Well, it's thinking about it.
Okay.
Let's try that one.
All right. Thank you.
And I will get that password in there one more time.
That's interesting that it did that. Okay.
All right. And then this one at the top says, I want to go live in a nursing home and leave behind my loved ones and the comfort of my own home, said no one ever.
Okay. What we have done is we've created a few different ads. And so what we have found is that if you put them into a local newspaper, a senior type of a newspaper, that you will indeed pick up some clientele that way. So a lot of you have clients that you're probably thinking already, geez, I had that one client that was too old for that home health care plan, or I had that one client that got turned down. I had that other client that had that mobility issue, and the other one, they couldn't afford it. So you're probably thinking already, I have a few clients that I can go to immediately. That's it, kind of, if you will, the cream off the top, your A list. And however, if you all of a sudden get in a situation where you find I'd like to go pick up some new clients, then we have advertisements. This is a half page. We have full page, and we have advertisement all the way to the setting of commercials. We do seminars for you. We have all the sales tools that are available to you, and it's available to you on this website. But what I'm going to do as well is I am sending a package over to Sean, so he and his team members can get this out to you. It will be everything in the package, which will be complete. Will be all of our sales tools, which will give you everything from the brochures to the ads, the commercials, the seminar scripts, the seminar presentations, and they're professionally done on video. And so we'll have all that available to you at your fingertips. Also, contracting will be sent over to Sean and his team as well, for you to be able to get over to us. It's a very short. We're trying to keep everything as simple as possible and as easy as possible. So we did a little shorter version on that as well. So just for everybody that's listening today, we have taken the time to go to professional studios, to pay professional actors, and to have professionally scripted out seminars that work, and they work well. Of course, you need to be in the right crowd. You got to have the senior market. You have to have someone that is going to have some type of a need or desire, or that type of a clientele, as you already know. But by having the seminars available to you, there's two things that happen here. And again, I urge you, just like I did with the brochure, I urge you so much to listen to this seminar, because it will walk you through what we do. Now, John, who's been in the business even longer than I have, it's safe to say he's probably never had a standing ovation on any seminar. And I don't mean that bad, John. But what I mean by it is that when we did this seminar presentation in a video form, we played it at a country club for, of course, seniors. And when we did that and the presentation was over, John got his first standing ovation. They literally stood up and they clapped and they said it was great, it was wonderful, and we were able to write some business out of it. So my point being is this: we'll provide you advertisement to get people to there, to whatever event you're putting together. It could be a senior center, it could be a country club, it could be whatever you want. But we'll provide you ads if you want us to. You could do your own if you choose. But we also provide you with the seminar video. If for some reason you got there and you said, geez, I can't play a video because they don't have the right setup for it, we have also taken the time to script this out for you, word for word, so it can put it in your own personality and swing it your own way, and then follow that as a script. A lot of people don't like to do seminars because they really don't feel comfortable talking. But if it's already scripted out and you have it as to follow, it really makes things a whole lot easier. I've done thousands and thousands of seminars over my career, and I will tell you that if I didn't have guidelines, I didn't have a way to follow everything, I would have been horrible. I wouldn't have been able to set appointments. So you have to have something. I don't care if it's bullet points or some type of a scripted out presentation. It makes all the difference in the world. And so, Catherine, am I able to hear anybody? Can I ask if there's any questions? Is that okay?
Yeah, so we actually do have quite a few questions here. So I will just start kind of reading off a couple of them here. So the first question that we have is, which service provider networks do you support?
Which service do they mean it when they say that? Do they mean what home health care agencies do we work with? And if that's the case, and I'll answer that just in case it's not the right answer. Hopefully it is. But we do not have a specific one that we will work with. We have several that we like and we prefer. But if there is a home health care agency that is a licensed facility, doesn't matter what city or state, we'd be happy to have them contracted, and we'll work with them without any issues whatsoever. We just have to vet them out to make sure that they are properly licensed, and that they are bonded as well. So if those two things take place, that's great. One thing I did not mention, and unfortunately I failed to mention because this is actually kind of a big thing as well, is that our company is the only company I know of that will actually pay family, not just friends, but pay family, friends, or some loved one that can also do the home health care for them, and we'll pay that family member or the loved one in replacement of the home health care agency. Now, there's one requirement to that, and the person that is going to take care of the neighbor, or it could be the daughter, it could be the son, it could be whatever. We have to have them go through a basic online course. It's not very long, but it does indeed allow us to understand that they've got the basics to be able to do that. One thing I'll tell you about the family and friends that's nice is that I've had several friends this year that have had parents that have had issues. They've had to take off time from work. They've had to leave work early, as you can imagine. They've had to perhaps go into work late. They're still having to run their household. They're still having to run their life and their family. And so they're leaving work after a long day to go take care of mom for a long period of time. Then one's taking care of dad, one's taking care of mom right now. My two friends that are doing this. And so no one's compensating them. No one, when they're leaving work, they're not getting paid for that time when they leave work. They're losing money to go take care of mom and dad. This plan will actually compensate the family to actually go take care of mom and dad to help subsidize the money they just lost. So I think that's pretty important. And I hope I answered that question. I know that was long-winded, but hopefully that answered it. If not, I'd be happy to do it again. So next question.
All right. So the next question that we have here is this the same as True Freedom? If not, what makes it different?
Okay, that's a question that is great question. It is similar to True Freedom, and the reason I say that is because the guys that created True Freedom, I used to work with once upon a time. As a matter of fact, as I know all those guys over there, the guys that developed this also worked over there at one particular time. So it was very similar start, very similar time frame on everything. The difference is that True Freedom they're just a little bit more expensive than we are. They don't have a paid up plan. They don't have something that will take care of allow the family member. They'll allow a friend, but they won't allow a family member to get paid. They also don't have rebates, which I didn't also talk about. But after the fifth year, if a person, the sixth year, going into the sixth year, a person doesn't have any health claims, we give them back 50% of all the premium on the next year. So there's benefits like that go throughout the plan as well. That make it just a little bit better, a little bit safer for the person. To be working on not safer. I'm sorry, that's the wrong word. A little bit because it's paid up. It's a little bit of a better bet that you're not going to waste money, because if you don't use it, you lose it on the other plans. In this situation, if you don't use it, at least it's paid up until down the road. So great question. Thank you.
Perfect. And the next question that we have here is the cost of the membership dependent on age and health condition?
Okay, very good. No, As a matter of fact, it's not, which makes things a lot different than being in a traditional type of an LTC plan. You can be, if you were, again, if you were 50 years old or if you're 110 years old, the premium would be exactly the same. And the reason that is because we're working with a membership plan and not an underwritten insurance plan by state regulations. So by being under a member service provider contract, it allows us to put everybody together very much, if you will, like a when you're doing health insurance and you've got a big group and you have to put them all together, and you can't just take one person out of the group and say this person's cost more than the other. You have to put them all together as a large group. Same thing here. When you're doing a membership, you can't actually single anybody out. So health doesn't matter for us, and age doesn't matter for us for any type of premiums. Thank you.
Perfect. And then the next question that we have is probably something that everyone is thinking, what is the commission on these plans?
Oh, no, you just do this because you love us. The commission on these plans is 40% of the premium that is collected. So therefore, the premium on this, let's just say it was let's just say it was $5,000, right? So you add a 40%, your commission's $2,000. The following year, you're going to make this is another thing about True Freedom as well. Our commission structure might be a little better. The following year, our renewals are 15%, and our renewals are 15% every year as long as that plan is in effect.
All right. And the next question that we have here is actually about some of the membership levels. Mm-hmm. So while you're getting into that, I'm going to pop open that chart again for you so I can share that as you go over it.
And I do have one sheet as well, which is available to everybody to show them all levels. That this is a sample of, but when you receive your packet, you'll receive everything, which will show you every level.
Perfect. So for you guys that have questions about the membership levels, Todd will be sending over all of them, but here's a quick example for you on the screen. So starting at the top, we've got that 10,000 membership hours, $250,000 self-pay value, membership plan cost is $5,000. And then in the example that we've got here, we've got 2,000 membership hours, a $50,000 self-pay value, and then a $1,000 membership plan.
Yeah, and if I can, I'll just talk just a tad bit about that as well. When we put this brochure together, and this is something that is just, it's a little scary, to be honest, how fast healthcare costs are rising. But when we put this cost together, this chart together, the cost of home healthcare was averaging $25 an hour. It has gone up since even this brochure, and this brochure is only about a year old. But it has gone up. And so now realistically, we're going to be that number, instead of being based upon $25 an hour, you're going to be based upon closer to $30 an hour. But our rates didn't increase. Even though home health care costs did increase, we did not increase our rate. As a matter of fact, we have not increased our rate one time. And so what we're gonna keep it like that as long as we possibly can. Of course, if all of a sudden home health care rates shot up to $60 an hour, we'd have no choice but to increase them. But we haven't. We've held strong. We've kept it where it is, and we've seen some increases by quite a bit. If we go back a few years, by the way, home health care was only averaging about $15 an hour. So it's gone up significant, but again, our rates have held strong.
Perfect. So we actually have a couple of different questions coming in about the plan. So I'm going to hit all of those ones that I'm seeing all at once, just so we don't have to kind of come back to this. But the next question we have about that is, so the hours in the plan, is that per year, or is that the total benefit amount that the client can get with that plan?
Oh, okay, great. Thank you. That's a really good question, actually. For the hours, they're lifetime hours. And so you don't have to use them all in 1 year. Those hours are available for your entire life. But the premium is on an annual basis. And so if you do it, if you pay annual instead of monthly, quarterly, or semi-annual, the plan will be paid up in 10 years. And so they do not have to pay anything beyond that point. And so let's just say someone was 70 years old, and they started the plan, at 80, they're paid up, and they may need it 4, 5, 6 times during their lifetime, and it's paid up. So it's not like anything's ever going to increase. It can't happen. They're done. They're in a great position.
Perfect. All right. And then the next question we have about that is, can you talk about the potential market size and when would a person sign up for this membership? It is
Sure.
their first time learning about this concept. So.
Oh, okay, sure. Generally speaking, is when someone gets into long-term care, statistically, the average age, not the average age of long-term care, but the average age of someone entering, if you will, a contract or an insurance plan, and with that is at age 70. However, I think a smart market, because we have the 10-year pay, when people turn 65 and they end up on Medicare, that's a great market to go after, because one is they're getting into something they've never seen before, the Medicare plans, and so in the Medicare supplements, if they're not on a different type of plan, what's going to happen is they're going to realize that there's some holes in there, and those holes in the Medicare supplements is they only cover skilled home care for a very limited amount of time. They don't cover anything into this custodial care, and that's what you do 90% of the time: cooking, cleaning, bathing, dressing, transferring, going in back and forth to the doctor, doing the things that you should be doing on a day-to-day basis. And that's why they're called daily activities. And so those are the things that you need to have covered that aren't covered. So the market to go after would be anything from really the time they get on to Medicare plus. Oh, I want to say one other thing too. One thing I did not talk about, and this is a really huge advantage. We contracted with a company called Amaze. Amaze Health is actually a teledoc, and so our people have access to Amaze Health teledoc. Now, what that is most people pay about $1,000 a month for a really good concierge service, medical doctor, nurse availability, and our services are available, and they're available at 24 hours a day, 7 days a week. You can have a medical doctor available to you. You have RNs available, practitioners, assistants, and so on. And we only charge the client $25 for a monthly fee for this service. So again, typical, and I'm not kidding. Yeah, ask around of whoever you've dealt with in the past for that service. It's like $1,000. It's like $1,000 a month. So we all have it in our company. 100% of us have it. I will tell you, yesterday, and the reason my voice sounds so weird, and I guess most of you wouldn't know that right now, but I don't sound like this. I have had a cold for the last few days, and I had to use Amaze yesterday because I felt horrible, and I knew I had a presentation today, and I didn't think I was going to be able to actually do it. So with that said, I had to call them up. I call them, and within a few minutes, they go through this little interview with me of what's wrong. They called all my medications in directly to the CVS pharmacy right around the corner from me. Within 5 minutes, is called into the pharmacy. I go over there. I pick it up from the pharmacy. I don't go to a walk-in clinic. I don't go to my doctor. I don't go through all that crap. What I do is I simply call them up on either a video call or a normal phone call, and they take care of everything for you. Now, they'll do the same thing for your patients, excuse me. They'll do the same thing for your clients as well, if they'll actually join up for the Amaze health care as well. It's a huge benefit from a home health care standpoint of view for assessments. It's a required necessity. They have to have an assessment, right? So if they have somebody there that can be helpful to them, and it could be any question, nothing's too ridiculous on the questions when it comes to health. So your client would have access to this kind of service for literally adding $25 a month to their plan. So they don't have to have it, but it's available to them, and it's a heck of a benefit. I've used it about 10 times in the last year. I love it, and I will hope I never have to do without it. And next question.
All right. So the next question is, does the membership apply to only home health care? And I think with that, are they asking, internal,
Nursing
like
home?
inside the house? Yeah.
Yeah, it does. It's actually kind of intended to keep you out of a nursing home. So it does not pay anything in a nursing home, and so it is designed 100% to keep you in the comfort of your own home while receiving care, and to do its very best to keep you out of a nursing home, and the very best it can to keep you from going to another level of where perhaps you waited too long and you had to go into a hospital and receive some type of medical care. So it is statistically found that home health care provides you better care, and you actually recover from the ailment quicker at home than a nursing home or a hospital setting. It is statistically there, and I can send articles on that, but they're Google them. It's there. So that's what we do, American Home Care Service, because of the fact that we're doing our very best to keep everybody out of a nursing home.
Perfect. Next question here is, how do you determine if the caregiver is qualified to provide services?
Good question. We have to vet them, and so we go through a vetting process with all home health care agencies that we'll license with. We have a network of home health care agencies. In the network allows us to pick up on any city in any state, and we can give maybe 5, 10, 15 different home healthcare agencies within that same city that are licensed, that have the bonding and have the rating that we need to work with. And then after that, we have to then license and contract with them. But when we license and contract with them, it is only because we've vetted them out and made sure that all their documentation and credentials are in place.
Perfect. So next question is, can you change plans, or are you locked in once you select one?
Oh, I don't know if anybody's asked me that question. That's a really good question. I like that. So, no, absolutely, 100% you can change. So what would take place is that, let's just say a person wanted to kind of put their toe in the water and just check us out and say, I'm going to start with a small plan of, 2,000 or 2,500 hours or something like that. And so they start on a smaller plan, and then they find that, they maybe stubbed their toe along the way and needed some care. They needed some help. And then later down the road, they wanted to turn it into a 5,000 or 7,000 or 10,000 hour. They absolutely can do it. There's only one rule. And that rule is that they must make that decision 14 days before or 14 days after, so 14 days within their anniversary. And that's the only thing we ask that they do. There's no requirements for them on their part to prove that their health hasn't changed. We will take them, but we will upgrade them one time. And the reason being is we all work in the senior market. And if you've ever been around an insurance agent that goes in, and I'm not saying it's anybody on this phone, trust me, I'm not saying that one bit, but I've been around it before, where an insurance agent gets really comfortable with a client, and he keeps going back and writing more and more and more insurance plans that the person may or may not need. So with us, what we did is we said, let's make sure that no one ever mistakes anybody in our organization for ever taking advantage of any situation. So what we do is we say, you can upgrade the person, but you have to upgrade them only one time. We don't want multiple plans being written.
Perfect. So next question that we have here is this an ACA accountable care organization?
I don't even know what that means. So I'm gonna say no because I have no idea what that is.
All right. Next question is how it's kind of in two parts, but it kind of seems like it's the same question. So, what is the contracting process, and then which states do you guys cover?
Okay, we cover all 50 states. We're approved in all 50 states, and the contracting is very simple. They'll receive the contracts from you, and we have contracts on our website. However, we do not want your folks that work through your agencies to pull our any of our applications from our website. And the reason being is that we've already taken the time to code the application for you in your agency and all of your agents, so that way we can identify everybody properly and we don't have to go through it one at a time. And that application will be available through, of course, that goes through NFI, and so you'll just NFI on your team will be responsible just to send that out.
Perfect. So, I don't see any other questions coming through here.
Okay.
So while I kind of wrap this up, I'll give you guys a couple of minutes to kind of put your final questions in there. If we don't have any, once I'm done with my little spiel, I'll just end the webinar. But our contact information, NFI Solutions, our information is pinned to the top of the chat. You can reach out to us at marketing@nfisolutions.com. You can give us a call at 952-887-1239, and we can talk to you guys about that contracting process. We did get, it was just a thanks. So looks like we did answer that question correctly there. So if you guys have any questions, please feel free to reach out to NFI Solutions. Todd, thank you so much for your time today. I know we had a little bit of technical issues here, but we powered through. We did a good job. No, I don't think so. I think it was just one of those things. But thank you so much for your time today. Attendees, thank you for your time today. If you have any questions, please feel free to reach out to NFI, and we look forward to hearing from you guys.
Oh, Catherine?
Yeah.
Oh, I want to squeeze in one more thing. I'm so sorry.
Absolutely.
But for our contacts, what I'm going to do is I'm going to send you also Maxine's information, because for any agent training, come to me, and I'll give you, of course, all your agents have access to my email, and I'll be happy to do any further training that needs to be done. But for any administrative work, any files and forms and documents of advertisement and all that kind of stuff that you might need with our companies, that's going to go through Maxine, and I'm going to provide her information to everybody as well. So when they contact our company, they know training me, everything else Maxine.
Perfect. Awesome. So just to recap that for you guys, if you guys have any questions about admin stuff, reach out to NFI Solutions. We will put you in touch with Maxine here. And then everything else, Todd will be our guy. So with that, I didn't see any other questions pop through as we were going through that final pieces of information. So I think we will stop it here. Thank you so much for your time. We will be sending out a recording after this webinar ends. It might take a little bit longer than we usually get out to you guys. We're going to try to edit out some of those technical difficulties there. But we will get you guys a copy. And thanks so much for joining. Have a great rest of your day.
Thank you.
Thank you.